Governor Tim Walz proposed a sweeping overhaul of Medicaid in Minnesota, but got a chilly reception at the Capitol, and the state's uninsured rate nearly doubled in the last 3 years. Welcome to the March 13th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Maddie McGurran.
Minnesota Governor Tim Walz proposed a massive overhaul of the state's Medicaid-funded programs this week, pulling administrative work for covering more than 1 million Minnesotans back to St. Paul. Walz and Department of Human Services Commissioner Shireen Gandhi announced the plan as the state responds to a funding freeze from the Centers for Medicare and Medicaid Services, as well as generational changes approved by Congress last summer. The DHS commissioner unveiled the biggest changes for Minnesota's Medicaid program, known as Medical Assistance, or MA, at a Tuesday press conference.
We are proposing to centralize the administration of Medicaid by phasing out managed care contracts for Medicaid, changing how we serve about 80% of Minnesotans who are on the Medicaid program, moving some of the work of Medicaid eligibility from the counties to DHS, easing workforce pressures that we are hearing about from our county partners at the local level, and streamlining how a person is eligible for Medicaid.
There are 8 different managed care organizations that work with the state now. MCOs like Blue Plus, Health Partners, and Medica currently serve as the insurance carrier for more than 100,000 Minnesotans each. Minnesota would bring in a new administrative service organization, a statewide contract overseen by DHS, possibly one of the incumbent MCOs. The Senate Health and Human Services Committee heard a proposal for such a new administrative structure. Health plans warned that MCOs often package together their private and public beneficiaries to make contracts more acceptable to care providers. Chelsea Olson with the Minnesota Council of Health Plans told lawmakers dividing commercial and public programs risked creating a second class of beneficiaries with lower reimbursement.
The reality is that a similar impact is already seen in the MA dental program, where enrollees struggle to get appointments.
The other major change in Walz's proposal, the state would handle eligibility determinations instead of counties. Minnesota is one of only a few states that leaves those applications to local jurisdictions. The proposal comes as Minnesota is racing to respond to a federal funding freeze instituted in the wake of wide-ranging and high-profile Medicaid fraud scandals. The state is also trying to prepare for new Medicaid requirements in the One Big Beautiful Bill Act that will institute work requirements and semi-annual reviews of eligibility for beneficiaries. Those changes will start before Minnesota's 2027 legislative session, but Walz's proposal got a chilly reception from lawmakers this week.
There was more news about MCOs this week as well, about the collapse of Minnesota's largest Medicaid insurer. Fox 9 reported that Medicaid payouts at UCare more than doubled in the 3 years before the health plan shut down. Fox 9 cited state data showing that from 2018 to 2021, UCare paid out $250 to $300 million per year. No other MCO topped $200 million. By 2024, Medicaid payments ballooned to nearly $500 million. Fox 9 said that court records also show UCare kept paying several Medicaid providers for years despite credible allegations of fraud and numerous red flags. The 4 largest hospital systems in Minnesota, Mayo Clinic, Allina Health, Fairview, and Hennepin Healthcare, are owed nearly $500 million for care already provided or still being provided to UCare members, according to recent court filings.
The Star Tribune reported the state also issued a warning to UCare earlier this year after its acquisition by Medica, after beneficiaries reported hour-long hold times when they called to arrange non-emergency medical transportation. Some areas of the state reportedly offered no non-emergency transportation at all. Medica told the Star Tribune that some providers had dropped out because of unpaid UCare claims, but state officials said other providers had dropped out because of fraud and abuse investigations. Also this week, the Minnesota Department of Health reported a significant rise in the number of Minnesotans without health insurance. The number grew from 2.8% in 2023 to 5.8% in 2025. Those are some of the highest levels since the Affordable Care Act was passed. The spike also happened before Congress cut off pandemic-era Affordable Care Act subsidies in January. State officials said they expect the number to continue to grow and that parts of the population, like communities of color, are seeing as much as double the average uninsured rate.
That also comes as a new Gallup poll found that as many as a third of Americans are cutting back to afford health care. Responses include everything from rationing prescription drugs and skipping meals to postponing retirement or having children. Half of people making less than $48,000 per year had to cut back to pay for health care, Gallup said.
Also this week, a bill to legalize psilocybin mushrooms got its first hearing in the Minnesota House. A bill filed last year outlines rules for use of so-called magic mushrooms, including cultivation, locations, and rules for the use of the mushrooms, and a public education campaign. Users would have to be at least 21 years old, undergo a health screening, and register with the state, similar to the state's medical marijuana program that opened in 2015 and has since evolved into full-blown legalization. And finally this week, two significant developments in Washington. Ellen Florek has more.
First, the Trump administration announced a new cybersecurity initiative, which may include mandates for everything from banks to hospitals. The new strategy says users have to, quote, move away from adversary vendors and products and adopt U.S.-based technologies. Also, the Centers for Medicare and Medicaid Services says it has sent out the first round of $200 million in funding to implement the Medicaid work requirement due to go into effect next year. Inside Health Policy reported Georgia alone spent $52 million updating Medicaid technology for their state work requirement.
And that's it for this week from Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Maddie McGurran.
Thanks for listening.